Ready to start?
Ready to start?
Okay, here we go.
Okay.
And then they wonder, what does it mean to live and
Hi, everyone. Welcome to our podcast, And Then They Wondered. I'm Carolina.
And I'm Rebecca.
We are so glad that you're here. Today, we are going to be talking about hospice, hospice care, and more specifically, your hospice team.
That's right. Once you get started on hospice, once you sign up for hospice, honestly, the first week can be a little busy because you're meeting your team, the team members that you're going to be seeing regularly over the days, weeks, months to come. So we want to kind of introduce those team members to you. We're actually going to have a special guest for a portion of the podcast talking about what she does in hospice.
Yes.
But we want to talk about the other team members that you can expect to be providing care. So who's our first one we're going to talk about?
Okay, we're going to talk first about our RN/LPN. They typically tend to be a duo team. Case manager. Typically, the case manager is your RN, but the LPN assists with the plan of care that has been outlined by the case manager. So the case manager kind of oversees to make sure that the plan of care is appropriate for whatever is going on specifically with you or your loved one. So for example, if my loved one has a lot of pain, the top of the list on that care plan will be focused on the pain, or some nausea or constipation, whatever the case may be. Those are going to be the plans of care, the things that we kind of focus on primarily. And a lot of times these plans of care don't typically stay the same from case to case or from day to day. There's a lot of variation and a lot of changes. So that's something that the RN case manager kind of takes on.
I always think of it almost like the case manager is like the quarterback of the team.
Yeah, she is.
Like she's telling everyone where to go, what play are we running, what's our main concern right now, and what are we going to do about that. And she's the primary team member that is going to be the communicator between your family, your situation, and the hospice medical director, which is someone we'll talk about a little later on.
They're actually next.
They're next. All right, that's perfect.
My little list.
That's perfect.
So the hospice medical director, we a lot of times call them MDs just because medical director, and they actually are
An MD.
medical doctors.
Yes.
So they are the ones that also oversee the plan of care to make sure that it continues to be appropriate. They also make sure that, well, first of all, let's back up a little bit. They assess, or the nurse rather, assesses the appropriateness of this hospice admission, and the physician okays it or doesn't, and then a lot of times determine the admitting diagnosis with the help of the RN, of course. So that's really the role of the medical director. Also, they provide good medical knowledge, obviously, on the disease progression and help kind of building that plan of care, as well as medication decisions. So those are kind of the highlights. I don't know if you want to add anything else.
I think one of the big questions we get a lot, and one of the things that people wonder about probably when they hear this is, but what about my doctor?
That's a good one. That is. So if you have a good relationship with your primary doctor, you are entitled to pick whatever physician to follow your case on hospice. Now, a lot of doctors will say, you know what, I'm not really all that well versed in hospice care. I defer to the medical director. And they can still be secondary on your case. That's no problem at all. I have had cases, though, where the primary physician really wants to follow the case, and they have like a really good relationship with the patient and the family. And this is really great because they kind of understand that hospice is kind of like a middle of the night scenario type of thing, that where they need to be notified, and it's never, an 8 to 5 deal. So we're on call 24/7.
Correct.
And the medical director is also on call 24/7 with the RN. And then the physician that follows, especially if they know how hospice works, will agree to say, this is I've had cases like this. This is my private phone number. Please call me. Please notify me. And that is not as rare as you would think, actually.
Honestly,
Yeah.
so often we'll have cases where, honestly, I've had so many where it was like, well, they took care of my mom and my dad, and now they're my physician, and there's that long-standing relationship. And so when there's a connection there, a lot of times the physician will follow you. But if not, having the hospice medical director available 24/7 can be huge when in those moments when we need orders right away. So, but no matter what, the hospice medical director is always available as a backup,
The secondary.
as the
Typically.
secondary. So if for some reason you choose to be followed by your primary care physician, but you were not able to reach them at night or something, or they're not available after hours, we will still call our medical director if needed to be able to get the orders, so we're not leaving you hanging.
That's right. And I kind of want to jump back to the RN on-call role because it's super important. And I think when people realize, hey, you can call us Sunday afternoon at 2 p.m. or, Monday at 2 a.m., we're available 24/7. It's an RN typically that's on call during that time. And I think it's really important to highlight that role as well. Like, when do you want to be calling the on-call nurse?
I think any change of condition. I always tell families there are no bad questions. The only bad question is the question you don't ask.
Right.
I want our families to be calling. I want them to be proactive. If there's any change in condition, just contact the nurse. Maybe it's nothing. But then you have the peace of mind of having spoken with her. She can update your care team about what's been going on. And if there is something going on, we don't want to miss it. We don't want to let the symptoms get ahead of us. That's a big thing in hospice care because there are changes that can start to occur that don't look like what they are right away.
Right.
Unless you know.
Right.
Unless you've worked with it and you've been around end of life for a long time, you don't know what's going on. There's no way you could. And so calling when it's like, they're just, even if it's as simple as like, they're just more confused. Like they don't know where they are. Please call. Or if there's anything like a fall or things like that, sometimes if you call, a specific question that you may have can just be answered over the phone. But the on-call nurse with a hospice company is not just like a phone line nurse with your doctor's office. We will come out and make visits. We will come see you. And I have worked on-call for a long time, and I love that. I actually like it when people call. Because I'm like,
I prefer people call.
I prefer people call than I find out too late or I'm racing to try to catch up with things. I would rather people be really proactive.
Yeah, for sure. I think I've had situations, I've worn all the hats in hospice, but
Same.
yeah, but when I find out, that somebody had called at 8 a.m. because of an issue they were dealing with overnight.
Oh, breaks my heart.
It does. It really does. It's something that you don't have to deal with for an extended amount of time. Even if you think, well, I got a couple hours of sleep and they started back up again. We still want to know. We still want to help you. We still want to be there. Because you need the rest too,
Exactly. And so often symptoms are really, really easy to treat if we catch them early. But they become exponentially more difficult to treat the longer we wait. So somebody who starts seeing symptoms at 6 or 7 at night and is like, I don't want to bother on call, I don't want to bother anybody, and they just suffer through the night. Now to get that under control the next day, we're making up for lost time.
Yeah, and it's just kind of like a big snowball. I always liken really pain symptoms. I always tell people, as soon as you have pain, you have to do something about it. Pain can rapidly
It's just going to get away from
spiral. And then you're at the point where you're trying to put out a forest fire with a bucket of water.
Exactly. I mean, it's really like, if you think about, okay, this is going to be a really kind of morbid, maybe. Okay. I don't know. I always say that. I always give that warning.
I know.
But okay, if you like jump off of a high dive into a pool of water, that's not a bad experience.
Right.
But if you were to jump into the pool without water and then try to fill up the pool later, totally different experience.
That is true.
And that's kind of what happens when we know there's going to be pain. We see pain starting and we don't treat it right away. A lot of times we'll treat it with what we have, but it's not working. If that's happening, if you've been on an order and you've had like a certain dosage that you're taking, but all of a sudden that's not working, don't try to power through. Powering through is not going to help you. You need to call and get a new order. And that's what that on-call nurse is for.
Yeah. So that's really good. We're obviously very passionate about people calling. Please take advantage. Please take advantage. Yeah. Okay, the next person is our hospice aide.
Oh, we love the hospice aide.
We love the hospice aide.
Seriously, a good aide makes all the difference.
100%.
They so often are able to catch things so early, see problems before they start to happen,
Yes.
catch decline quickly, because the aide is somebody who's going through your activities of daily living with you when they do their visit. So any new weakness or any new skin breakdown, they're going to catch it pretty quickly usually.
And they always communicate that with the nurse, hey, I was trying to get Mrs. So-and-so into the shower today, and she had a really hard time getting her foot into the tub, and that's not usually the case. So things like that may seem minute to other people, the hospice aide can catch and say, no, this is not normal, can alert the nurse, and the nurse can be like, okay, I got to be on the lookout for, sudden weakness, or what happened, was there a fall that was unreported, et cetera, things like that. So there's so much investigation involved, and it's so important that we do have those hospice aides. Two, they are certified nurses aides, and so they absolutely know what they're doing. And they, if you allow them to do the personal cares and hygiene, they can see the patient completely naked, which is actually a very good thing. We're talking about 2 times a week, laying eyes on their entire skin, and then they can say, hey, I saw something on their butt. It looks like the start of a pressure sore, and we can immediately get that started, because pressure sores, I think, can also snowball pretty quickly.
Very quickly, very, very quickly. They can just, especially in a patient who we know is probably not eating well, not drinking well, we're talking a matter of hours. You can suddenly have a whole new problem on your hands.
Exactly.
So, and a whole new cause of pain on your hands and things like that. So we can actually order equipment. We can order pads, lotions, creams. There's a lot of tools in the hospice tool belt that can be used if we catch wounds early to help prevent them from getting worse.
And we want to catch wounds early.
We do.
It's a source of pain, infection, grief for everybody involved, So,
so true.
Yeah, so we do want to make sure that we are aware of that.
To the hospice aide,
We love them.
we love them.
And if you are a hospice aide, thank you from the bottom of our hearts for everything that you do, truly.
Honestly, any CNA or aide, you guys have the power to make or break somebody's day, someone's experience.
For real.
They're the real heroes.
They really are.
Yeah.
So anyway, kudos to our hospice nurses.
Yes.
Or CNAs.
CNAs and nurses. Everybody.
All the CNAs.
Kudos to everyone,
Yes.
but especially CNAs.
And then we have our chaplain, which AKA spiritual counselor, AKA bereavement coordinator,
Typically.
AKA grief counselor.
Yes. They wear several hats, but they're all in the same category of your emotional, spiritual health. One of the things that I hear a lot of times is either I'm not very religious, so I don't think that would be helpful, or I am this specific religion, so I don't think that I can see your chaplain.
Yes.
So let's talk about
We've
that.
heard that a lot. One thing to keep in mind is, even though they're referred to as chaplain, they deal with grief, meaning loss. They're experts in this field, and they're able to provide you that spiritual support when there is spiritual distress, because everybody has this, religious or not. It has more to do with like kind of your soul, your legacy, meaning of life, things like that. And, everybody does experience that. So I think that they're so important and a critical part of your team. Even if you do feel like, oh, I'm totally at peace with what comes after, it's just a good support system to have, because they can have their initial assessment with you and find, actually, we kind of have to work on this a little bit. Or with your family, they can go and see your family instead of the patient specifically. So I think they're just so important and not really utilized as much as I think they probably should. And two, I've had experiences with several Catholic patients who say, I'm Roman Catholic, I only want a priest. Our chaplains are able, especially if you need last rites at 1 a.m., our chaplains
They're
are able to get you a priest at 1 a.m. So that's one of the things that I'm like, I think they don't get enough credit either.
I think so, because there is also the very real world in which they can be that person that goes between and helps coordinate getting your preferred spiritual advisor to come visit, whether that's Buddhist or if you maybe attend some other. I just think Buddhist because I had a Buddhist family one time, but they coordinated with like the Buddhist temple here in
Yeah,
town,
yeah.
and like got people to
I
come
think I
see
remember
them.
that. I think I do
So-
remember that. That was really
So it's one of
neat.
those things where
Yeah.
it's like initially they were like, I don't know if we need a chaplain, but just having that at first initial visit, they can make sure that even if you prefer to have someone else support you, they can make sure that you're getting that support. And that's so important. We were talking before we started that I went before this and got a facial today, and I was telling the lady, I was like, I need to not get my lashes wet because I need them to stay. I need them to stay on for like 3 more hours because we're going to shoot this podcast. And she's like, "Oh, what's your podcast about?" And I told her, and she was like, "Oh, I don't do death stuff, conversations."
that's sad.
And I was like, "Oh, wow." Or I don't. I remember I said, "Oh yeah," I did something, just kind of like, "Tell me more."
Yeah, yeah.
And she shared that she lost her husband very unexpectedly recently, and I think that as we talked about that, really it reminded me, not that we're ever too far away from this, because working with it every day, you're always reminded, but the reality is none of us get out of this as the same person that went into
Right.
it. Death
100%.
changes you. Grief changes you. The process changes you from day to day. It's almost like this giant wave that's just continually changing you. Like you think about like a wave from the ocean, it comes in, and when it goes out, that beach doesn't look the same.
That's true.
And I feel like that's kind of what grief is.
Yeah.
It comes in like a wave, and then it goes out, and you're just not the same, and then it comes in again, and then it goes out, and you're not the same. And what kind of support you're going to need during that process is going to change throughout the
Yeah.
process. So having a team available and knowing that team and having built some kind of relationship with them so you feel comfortable talking to them is really important.
And I think that's where that bereavement counselor comes in, because this is a very difficult process, whether you have a good relationship or not, or, you have regret or guilt. These are just really big emotions that we should never have to walk alone.
Exactly.
So,
Yes. Don't even try to do it alone.
no, just don't.
Even if you lost a loved one and they weren't on hospice care, you don't have that bereavement support. There's Grief Share. There's so many great groups to help support you through the process. So
Absolutely.
I think nobody should try to walk through grief alone.
That's right. And then last but not least is our medical social worker. I had talked briefly before about how I don't really know what it is that they do. And so I got the chance to actually interview one.
I love it.
Because I really wanted to get in and figure out what it is that they do and how they can provide a lot of resources for us. And so I would like for you guys to check it out. Hi, I'm here with Rebecca. She is our medical social worker. Well, no, that's not true. She's not my medical social worker or ours. She is a medical social worker, but I'm going to let her explain. We are sitting at Penny's in the Village. So if you hear some music in the background, that's what it is. Hey, Rebecca.
Hi, thank you guys for having me. I'm Rebecca. I'm a hospice social worker. I graduated from KU in 20 let's see, 2007. Um and my first job out of school was in hospice, and I have worked in hospice since in some capacity, whether it be full-time or part-time. And I got involved in hospice really because of when I was very young, my grandfather was on services, and I um, just attribute it to that, to wanting to be able to help make a difference. I was really young when he passed and didn't really have a good concept of the dying process, and so helping families navigate that has always been important to me.
Thank you. Yeah, that is always a touching story whenever you can attach something personal for the reason why you got into hospice, and then you can really help people on a different level. So, going off of that, can you explain like what a hospice medical social worker does? Like, what do you do?
Absolutely. So I would say it's kind of two part. The first being we call it in general psychosocial support to patients and families. Now, that just means being there for them and supporting them through the dying process. So, helping them to understand what they might experience and helping them to navigate that. We provide support, counseling if it's very complex grief. We oftentimes will refer out for behavioral health services. But then the other big part of what social workers do is falls under the category resource allocation. And so what does that mean? That just means helping patients and families to access services that they need. So, for example, assessing for caregiver needs, because that's one of the biggest things that we see is caregiver burnout and caregiver fatigue. So, um, we're looking to see what kinds of social programs a person might qualify for. Do they need to apply for Medicaid? Do they need to apply for VA benefits? Do they have a long term care insurance policy that we can help family make a claim in order to get more support and services in the home? Sometimes it's for our home patients, they need Meals on Wheels, or they need, you know, other, maybe they need some help with transportation, just different things like that. So that's what a hospice social worker does.
Everything. That's so interesting, honestly. Like I didn't really know. I think anytime that I referred my patients to a social worker, it was anything that I wasn't able to answer or do, and I'd be like, "Yeah, just go talk to the social worker for that." And when families first meet you, what would you say they usually think that you do, or would do they misunderstand about your role?
Yeah, oftentimes there's a negative connotation with social services, and they may think that I'm there because of a perceived problem, whether real or not. So, helping them to understand that I'm really there to support them through this journey. Sometimes we, alongside with the nurse, do a lot of education with families on that dying process and what does that look like and feel like. And probably one of the hardest things that families go through is not knowing what to do. They are in the mindset of trying to cure this patient and help this patient and so helping them understand that you're not giving up. We're just having a switch. We're focusing on quality of life now, and especially in the dying phase, they don't know how to take care of a patient, their loved one. They feel scared, so sometimes it's just modeling that behavior too for them. Maybe you just sit down at the bedside and hold the patient's hand and encourage family to talk about memories, get out the photo album, and just talk about what they see in those photos so that their loved one can hear that and be a part of that on whatever level they're able to. And so I think that that's can be really powerful because it really brings the family together, and oftentimes will open up for between each other discussions, and sometimes unresolved conflict between families.
That's actually really good. That that you provide that kind of support because it's so important for them to be getting it not just from the nurse. Obviously a lot of times we're just very medically minded and we don't see a lot of the things that you do as a medical social worker. So as far as that goes, what would you say is the hardest part of hospice for families in particular that has nothing to do with symptom management?
Yeah, I think it's probably the fear of the unknown, not knowing what to expect, not knowing the outcome. They know that their loved one's going to pass, but what does that look like? What does that feel like? In anytime there are any other family dynamics involved, grief and loss and death and dying brings those issues to a whole new level. So when I can go out with my nurse and we can be a team, um, and the nurse can focus on getting this patient's symptoms under control, then that frees that nurse to really do her thing and get our patient comfortable with, and then I can spend some time with the family, and even if it's just walking and taking them to the other room and letting them decompress. Sometimes the hardest part for them is maybe they're feeling guilty and they don't um, have the permission to say, that this is hard and I don't want to do this anymore. I need a break. I'm really tired. As they feel bad about needing a break and they don't want to, they know their loved one needs the care.
I think that's really interesting. And tag teaming, I'm glad you brought that up because I do remember one time you and I tag teamed a patient. It was a very quick transition. I don't know if you recall, but it was like one of the first interactions you and I had. And for me, it was really powerful to kind of see you in action while I'm talking to a couple of the caregivers about medication management. You're in there with the rest of the family and the patient, just kind of helping them navigate the emotional side of it. Like I said before, as a nurse, sometimes I get into that clinical minded mode because, yeah, symptom management is important, but there's so much more to a person and their family members involved when it comes to this holistic type of care and end of life. So, what would you say then caregivers feel the most guilty about, but rarely ever say out loud? And maybe like you pick up on that and you want to give the caregiver permission to say that's okay to feel that way. And I'm here for that support.
Yeah, probably that they need help too. I
Mm.
think whether they realize it or not, it's sometimes, with our patients who have extended disease progression, maybe a patient with Parkinson's or dementia, it's been a long disease course, and we're coming in at the very end, and oftentimes, the fact that the person has now entered a new phase of life, the dying phase, it it's you know the caregiver almost feels sometimes a relief,
Mm.
and then they feel bit bad about that because they've been caregiving for so long and putting their own needs by the wayside. So sometimes it's, you know, maybe I can sit with this patient so they can just go for a walk, or maybe a lot of times I can contact other family members and explain, what's happening, and encourage them to get involved, because the primary caregiver is just used to doing it all and not asking for help. So giving them permission to ask for help, and then having them helping them to access it. So sometimes even role playing with adult children, like how they can ask their siblings for help.
Mm, that's good. Yeah. Um, and as far as like the permission to ask, like, hey, or the permission to feel okay, and say, hey, you've come in and you really have taken a load off of me. And it's mostly because you're just not doing it alone anymore. You have this team of people that's going to be caring for you in a different manner, like more deeply. So, what would you say is the biggest takeaway for your role and what you provide?
I'd say getting social work involved from the very beginning, so that we can build that rapport, and get to know our patients and families, so that when we tell them things, they trust that we have their best interest, and that what we are saying, comes from a place of that we deeply care about them, but that it's, what we do all day, and we know what we're doing, and we're happy to be there and be involved and help, because a lot of times these families, they don't know what they don't know, right?
Mhm.
They've never done this before. So to me, the patient, we only have, as a hospice team, we only have one chance to get it right, because they're not going to die twice. So
Right.
we want to be there with the family and meet them where they're at, and give them that permission to let go a little bit and have some additional help.
Yeah, that's so good. And your role is vitally important along with every other role that there is. Of course, the nurse that provides the medical care and the medical director as well. You are the social aspect of it. You let them feel the guilt, you let them feel the relief, you let them feel the I need help. And that's huge emotionally for a lot of these families, and you help them get the resources. So that would you say that's a pretty good I guess, summary of what you do?
Yeah, definitely.
Okay. Very good. Well, thank you so much, Rebecca.
Yeah,
This was really great.
Thank you for having me.
I learned a ton. Wasn't that so good?
So good.
Yeah, I learned a lot. It was a really good experience. Anyway,
she's great.
so if you guys have any questions, more specific questions about your team, the people that you meet, the interview with the social worker, please comment below. We would love to hear from you. If you've had great experiences, we also would love to hear about those. I think we would really love to be able to even talk about some of your stories.
Oh, that would be so great. If you had a hospice team member that really impacted your life and your story and your journey, anything that we've described, they did something for you. Another thing that we didn't talk about was volunteers.
Volunteers, oh my gosh, you're right.
In
They're
hospice,
pretty phenomenal.
You're eligible to have a volunteer visit you. So, especially if you had a volunteer that did something that influenced you, that impacted you, that encouraged you through your journey, please let us know. We would love to highlight some of those stories.
We would, especially in regards to any of your team members, because they all play such vital and critical roles in our experience. So we really would love to hear from you. You can follow us on, or do we say that or no?
Yeah.
Okay. You can follow us on social media. We're on Instagram, TikTok, Facebook. Also, you can listen to us on Spotify, Apple.
Spotify, I think Amazon Podcasts.
Okay, great.
I need to double check that one's up and
And
running.
YouTube.
And YouTube. So be sure to follow us wherever you like to consume content. We want this to be a conversation, not just us talking to a screen. So please be sure to like, comment, and be sure to subscribe so you don't miss an episode.
We'll see you guys soon.
Let's take it deeper and take it kinder, and then